All right, Beth.
So I'm not sure what all was discussed last Friday, but let me just open by saying that Champlain Medical has been trying to pursue this idea of what we call direct primary care for several years. Well, any of you that knew Dr. Schwartzberg, that was one of his endeavors. And the goal with that is twofold. One is to allow folks to have access to primary care at a cost that is not prohibitive, so that you actually go ahead and go for that wellness visit and take care of those chronic problems, or those problems that they're there, but it's way too much money because of my deductible to go see somebody, so I'll just wait and hopefully it won't get worse. So that is sort of the idea, and what we're trying to do is to allow you guys access to take care of yourself, to do some rudimentary blood work. For many of you, you may not have ever had any blood work, but to just set some baselines, take a look at your family history, and do pretty much everything that primary care does, but in a different setting, in a setting where you're not going to get in and out of our office in 7 minutes. The practitioner is going to spend time with you, which is oftentimes not the norm in this day and age. And our goal is to work with you on your goals, so that you're a healthier person, so that you can live a more enjoyable, prosperous life, and oh, by the way, be able to continue to work as well, as long as you want to work. Other things that we're going to be doing, which is not normal, is for those of you that are on the Cigna plan, we will take a look at any scripts that you're on. And if you're on a prescription, for example, that is costing you a lot of money, or maybe it's not costing you a lot of money, but it's costing you enough money that it bothers you, we're going to take a look at that prescription, number one, to see if that prescription is a good prescription for you. Are there alternatives that are cheaper? Take a look at all the different options in terms of, are you getting the best bang for the buck in terms of when you go to pick up your prescription? Things like, you might not know that if you go to Kinney Drugs, it's $60 a month, whereas if you go to Costco's, it's $5 a month. Things of that nature. Also, for people that need specialty drugs, we're going to be looking again really closely at where can we get the best buck for you, as well as the company, because ultimately if the company saves money, as I hear they're giving you a no premium 2 month because you guys help save money. So we're going to look at that. Not only is it saving you money, but saving ECI money and giving you better care. Other things, if, for example, you screw up your knee and now you need an MRI on your knee, we're going to work with you to determine the most cost-effective way to get that MRI, so that it's less out of your pocket and or less out of ECI's pocket. Sometimes it might mean you need to travel for an hour, but if you can save $2,000, usually an hour's worth of driving is well worth it. What else, Ben?
You talked about the meds,
yeah.
Right? I think one of the things is now people have to get an appointment with their doctor. It might take them several days to get in.
Right.
And so what about the access to
right.
Champlain Medical?
Right.
If we don't feel well.
Right. So if you're part of the program, you can come into us on an urgent care basis and be taken care of just like you would be if you called your primary care and needed to get in there. The difference being we can get you in, whereas your primary care might tell you it's going to be 3 or 4 days for that sore throat or that cough that's nagging or whatever the case may be. So we're there on both ends, both from a primary care in terms of prevention, as well as from an urgent care, an acute illness, an acute injury, to try to deal with what's going on with you in a timely manner.
And how about people that want to stop smoking? Or
Oh, we would love to help people stop smoking.
right?
And I've heard rumors of, one of these days becoming a smoke-free environment with the company. And we're all about trying to give you ideas, if there's a group of you guys that want to quit smoking, to set up, if necessary, group rap sessions so you can whine with each other instead of getting your spouse all upset. Things of that nature. So we can help you with that. We can help you with, there's all kinds of different tricks of the trade in terms of trying to, number one, reduce smoking, and number two, quitting completely and working through that. And it'll also save your wallet in that regard, big time, not to mention your health.
So one of the big things I think is to discover something before it becomes evident that there's a problem.
Right.
Right? Which we've had a lot of people that have had issues where they found cancer and other really bad things, and they don't know until all of a sudden they're throwing up blood or whatever, right? And then on top of that is to get them referred to a specialist.
Right.
Part of this program, you guys could get referred to a specialist through the relationship with our program.
Right.
So I think you hit all the points.
Yeah.
That.
So with regards to specialty, you can't just show up at a specialist office. I even had a gentleman, an Amish gentleman with a hernia, and he called me because he needed a referral for to get to a surgeon. And it's the same thing holds true with you guys. If you need to see a specialist, we're going to try to work as best as we can with the system. Unfortunately, UVM owns most of the practices that are specialty, but there are some, for those that don't have insurance to work through things. And so, we'll be a good sounding board in terms of trying to work with you to make it as cost effective as possible.
I think we hit the major.
I think we want to re-summarize what is free for the employee.
Oh, okay.
Yeah.
Oh, so everybody wants to know what's free. Okay. So so what is free? So basically, all your visits with us are free. Did you hear that? Free. No copay, no deductible. Because ECI really cares about your health and about your well-being, and they want a good, healthy, productive workforce, and so they're investing in you to take care of yourself. So if you come to see us, nothing out of your pocket.
Unless you need medicine.
Right. If you need medicine, those aren't free, but we're going to work with you with finding the most cost-effective drug that'll do the job. If you need an MRI, again, we'll work with you to try to find the best place and the most cost-effective place to do MRIs. What else? And we'll also take some blood from you and do some basic screening. For those of you that are 50 and over, we're going to check for PSA cancers. Those with insurance, there's colonoscopies that insurance will pay for 100%. And for those without insurance, we have some other ideas on that. Those of you guys who have been smoking, 20-year pack smoking, there's also what we call low-dose CT that would, yes, there would be an associated cost with that, but it would tell us if you have pre-cancer or perhaps you have cancer hiding that nobody can find right now. So there's lots of things we could do for you. And, essentially, all the primary care stuff is free. And those initial labs will also be free.
And then the access to you guys helping find any grants or special programs, because some people that we have might qualify, right?
Right. So with regards to medication, if you need a specialty medication that normally, costs $250,000, we can go and look with you to find what they call patient assistance programs, where pharmaceuticals, bless their hearts, will actually give you the medicine for free if you meet the income requirements. And you'd be surprised at the income requirements are actually pretty high in terms of how high you can get paid and still qualify. Mm-hmm. So.
What about how this works with somebody's deductible if they're on our program or another program?
Okay, so with regards to deductible, we're not going to do any insurance billing, so it would not go towards your deductible. So that is always a question, or is it better to go to my deductible or not to go to my deductible? I think ultimately, unless you have a really big issue, it probably makes sense not to go to deductible. And then the other piece is for those that have HSAs, we can talk about those are health savings accounts in terms of paying for drugs, that type of thing. We can talk that language with you and see what makes the most sense. So
the catch is, we want people to get the baseline physical.
Right. Right. So in order to join, although we'll figure out if everybody joins all at once, it's going to create a problem for us. But in order to join, you need to have a physical. It's going to be similar to your DOT, but different.
Free physical, though. Free.
It's free physical. Well, the DOT is free too for them. But it'll be a free physical, and that's where we'll draw your blood. We're going to talk to you about family history. We're going to talk to you about your past medical history. We're going to talk to you about, pre-diabetes, if you might be pre-diabetic, and we're going to do that lab work and then talk about that lab work and what it means for you and what types of things we should be looking for or looking towards in terms of maintaining your own health. And once you've gotten through that initial portion, then you're free to come bother me or any of my other practitioners for urgent care injuries, urgent care sickness, urgent care mental health needs, anything that you would normally see from a primary care provider.
Beth, can you explain to these guys how ECI will not have any of this information that's between
Yes.
medical and...
Right. So with regards to confidentiality, the information is between myself and you, just the way it is with primary care. The only thing we're going to be providing ECI with is data and the bill, yes, and data that won't have your name on it, just very raw data about how many people we have that have prediabetes, how many people have we helped with smoking cessation, but beyond that, there won't be any identification of the individual. You're welcome to tell your friends that this is a great program and they should join, but that's between you and your friends.
Also, that their commitment is to set their own appointments up. It's not health and safety doing that. It's taking the bull by the horn.
Okay, and Alberta is telling me that she's not going to be mother hen, and that you will need to set up an appointment. And so when you call us to set up an appointment, you'll say that you're calling from ECI and you're calling for your physical as part of the direct primary care program. And that will set us down the path where you'll come in, you'll have your physical, we'll draw blood. For those of you that are nervous about getting your blood drawn, just tell Jamie or whoever's drawn your blood, they will lie you down and give you candy. And hopefully, you won't pass out. And if you do, no big deal. We've seen it before. So
they can come to health and safety to get the phone numbers and stuff like that.
We'll help.
We will.
Yeah,
help.
it's not. I'm just wanting to express that it's them taking the
initiative.
Yes.
They're the main contact between.
Being committed to their appointments they make.
Right.
We can really start some baseline appointments at any time, right?
Yes.
Yeah.
Yep.
And this starts like tomorrow, correct?
Yep. We can
if
start
we wanted
tomorrow.
To, we can start.
Yeah, we can start tomorrow.
And we'd love to see people.
Poison ivy and ticks, you can help our guys out.
Oh
with
yeah,
that.
and the other piece with ticks,
Oh, get one there, didn't you?
We for those of you that find ticks or ticks find you and they happen to get engorged, we're going to be putting together a lab that's what we call CLIA waived, in other words, kind of instantaneous at our facility, that 4 to 6 weeks after you've had that tick bite, you'll come in and get tested. And assuming that if the test is positive, we're going to send you your blood work off for confirmation. But if it's negative, it's negative.
Nice.
So that's one of the things we're going to do.
So you get to know whether you've got Lyme disease then.
Correct. Right. Rather than, we don't, I don't believe in treating somebody for 3 weeks with antibiotics if it's not necessary. I think it's, number one, not fun for the individual, and number two, unless it's warranted, it doesn't make sense.
Right. Yeah.
Very cool.
So questions?
Anybody who had their hands up or any questions, comments?
Ideas.
If you just want to unmute yourself and jump in, that'd be great. Are they anybody out there first?
They're probably all trying to get on the phone.
Ken, your hands is raised. I see you. You're active. Brian Labonte, you're always
I want to sign up for an appointment.
you're muted right now.
Oh, I am.
Yeah.
I want to sign up.
I got a question.
Okay, Brian.
Yeah, we can use this service as a referral for other screenings that we might need. Like if we have to get like colon cancer screenings or stuff like that.
Yes, absolutely. Yep, we can do that. We can refer you to GI, and if you're part of the Cigna plan, we will refer you to GI for your colonoscopy screening. The screening itself is covered 100% by Cigna. If they find any polyps, however, there's that goes to your deductible. But yeah, we can be a referral source just like any other primary care.
Mm-hmm. Good question. Cool.
Good question. Thanks, Brian. Anybody else out there? Oh, go ahead, Joe Appleton.
Hi, thanks. Where does the, as far as urgent care and primary care, is there any overlap there where we can go in with a slightly more urgent need and treat it as primary versus?
So
if I needed stitches or something personal, nothing related to work.
Oh, if you needed stitches.
Does that kind of?
That's an interesting question. If you needed stitches, I guess we're gonna suture you up.
On a weekend?
Not on a weekend.
Monday through Friday.
But you can call me. Well, so if you do it on the weekend and it's Saturday, you're probably out of luck because we got to suture you within 24 hours. However, if you do it on a Sunday and it's less than 24 hours, you can call me because I'm the poor person that answers the phone over the weekend, and we can talk about it. And as long as you can keep your bleeding controlled, we potentially could suture you up Monday morning.
And then that would be part of the program if they're in, maybe?
I guess so.
Well, it depends.
Urgent care.
That's urgent care.
Yep.
Just use a little super glue.
Hopefully you guys aren't going to get cut.
We're all going to cut it.
Joey, just super glue it.
Super good. Yeah, we use that too.
Stitch kit.
Yeah. Anything else, Joe Browse or Joe Appleton?
No, that was it. Kind of just a general question on the primary versus urgent care.
That's a good
separation.
Question. Joe Prowse, you got your hand up. The floor is yours. Or I'm sorry, Justin Pierno. JP. I guess wrong. Go ahead, Justin.
Just a quick question about dependents. If there's any, like you said, any availability for any kind of dependents. And the other one was chronic stuff. If there's something that's, like nuisance back pain or something like that. I know that's going to be like a physical therapy thing, but if there's anything more clinical than physical therapy, if there, just like, like to echo what Joey said, just informational,
Oh, well, certainly informational. If you're going to go see a primary care because you got back pain, that would hold true with us. Depending upon what the back pain looks like, we may refer you to physical therapy. We may give you exercises to do. We're going to try to use our resources to help you to keep the costs down. And if, in fact, based on your symptoms, it looks like you might be in need of a MRI to determine whether or not you've got a disc herniation or not. Most of the times, clinically, we can figure that out before even having the MRI. So we'll talk about that as well. The other question you had was
availability.
Oh, dependents. So this year we're going to start with just employees, and depending upon how the whole rollout goes, that may be in the offerings in the future.
I mean, just the care for the individual alone is generous as can be. So, that's wonderful. And so, but thank you.
Yep.
Well, I got.
Anybody else out there have any further questions or comments, or even want to
Ideas.
ideas
Would be helpful.
Yeah,
I like the cut.
Yeah.
A lot of times primary care won't suture, but I guess we're
right.
Guess we do. So did some this morning. Anybody else? I'm sure there's some more questions. Feel free to ask because this is a pilot program. You guys are going to be the first ones that we're going to do this with, and so there'll be some bumps along the road. But again, our goal is to, number one, give you access to care, which you may or may not have, or you may have, but you just don't use very often because it's either too expensive, inconvenient, or you might find out something you don't want to know. So.
I think part of it, we want some level of commitment by this baseline physical.
Right.
And that it's not a program that someone just kind of skips out and skips in when they need it.
Right. Yeah. So, the idea here, ECI is putting forth monies to make sure that, once you access the care, that if, for example, you've got some chronic conditions and one of the practitioners says, well, we'd like to see you back every 3 months, or we'd like to see you back 6 months. The concept here is that you're going to do your due diligence in terms of taking care of yourself by coming to the visits. And we're not going to willy-nilly ask you to come back unless it's for an important reason.
Do you schedule appointments for people? Like if they had to come back in 3 months, could you schedule ahead of time 3 months?
Yes.
If they wanted to?
Yes, because they're going to be you guys are going to be considered primary care patients with us.
Right.
And those people are allowed, unlike urgent care, primary care can schedule.
Yep.
Are you guys going to have a notification like my dentist has, like your appointment is tomorrow at whatever?
Yeah, so if you schedule with us and we've got your phone number or your email, you're going to get a notification 3 days in advance.
Right. So that's a good reminder.
Yes, so you should get reminders, multiple reminders.
Good.
I rely on those
Me
from
too.
doctors.
Me too. Any other questions?
2 hands.
Well, Joey, Appleton, your hand's still up, or?
Yeah, I had another question.
Yeah, go ahead.
And it doesn't really apply for me, but maybe someone will have it at some point. For those who do not have health insurance at all, is this something that will check that box for the state, you think, in any way, shape, or form, or?
No. That's the easy answer. No. In terms of being able to say that they have health insurance. No, this is not health insurance.
Yep.
Right.
Yeah, for taxi.
Wellness program.
Good question.
Yeah.
Good question, Joe. Any other questions, Joe Appleton?
I'm good for the moment. I'll take my hand down. Thanks.
Thank you. What about Justin? You have your hand still raised. Do you have another question?
Yeah, I'm just wondering, the blurry line between mental and physical health. How deep, if at all, do you go into things like, say someone's got, ADHD or something. That's probably a mental diagnosis, but can have physical affects.
Yep. Well, that is part of primary care.
Oh, it is?
Yeah. Your mental state as well as your physical state, it's all kind of interconnected.
Oh, no, most definitely. But I imagine there's a line where they're defined like, well, this is no longer part of our purview. Like I imagine mental health counseling or something like that.
So if it's a counseling that is going to be an ongoing counseling, then yes, we would try to refer you to somebody for counseling, and at that point, that money piece of it is separate from us. But yeah, we would refer. And if, for example, you had somebody who has never been diagnosed with ADHD, some of my practitioners are better than others in terms of sussing it out to make sure that we do think it's ADHD before we give you medication. My late husband would say, "Oh, give a medication. If it works, then they have it." that was Josh's way of diagnosing somebody. Well, and in terms of mental health, depression, of course, last year has been very, very rough on a lot of people. So the whole gamut, from mental health, physical health, and wellness. It's all part of primary care.
So I was talking about this today, with the people who I was working with, and I don't think any of them are on here with me. So, like, say I bring it up tomorrow and I talk about what it was and how good it is and what a generous offer it is. And there's a question about not so much specific to ADHD, but let's say I don't know, just something that may be relevant to somebody that's not necessarily like a splinter, or say you go to your physical and you feel like you do your physical and a month and a half later you're like maybe feel like I'm suffering from depression. Did you use up your chance when you had your physical, or
no?
That's a good question.
No, you make an appointment just like you would with any other primary care, and you come back in and we have a discussion about depression and whether or not you have the signs and symptoms. There's lots of tools we can use in terms of trying to suss that out. We can talk about doing things like, of course, there's lots of choices. The easy, quick one is medication, but there's other things that you can do in terms of understanding what your exercise routine is, in terms of doing kind of wellness checks within yourself. There's all kinds of things that can be done. So it's not, we don't just push pills.
Yeah, and also it's not just limited to one visit.
Right.
If you need,
so if for example,
you need 365 visits, which we don't anticipate,
I hope
potentially this program is what you need to do the primary care piece, right?
Right. So for example, if we put you on a medicine, we're not going to say sayonara, see you next year.
Yeah.
We're gonna come back in a month, right? And we're gonna see, okay, just like in any other primary care, how's it going? It might be a shorter visit, but how's it going? Make changes if we need to, and then schedule either whatever the case may be. If you're doing really great and it's all working good, we might not see you for 6 months, but
And what's needed, those visits are all included in.
Right.
Once you're in, you're in.
Right. Exactly.
Right. Good question.
Yeah, that's a good answer.
This question?
I feel like there may be that question, like, is this a one and done? Like, what if I go in and I do my physical and 3 months later I'm like, oh crap, I forgot to tell them about love.
No. You just once you've done the one and done, then you can use the program whenever you want to.
Gotcha. All right, that's again. Thank you. This is generous. This sounds like a wonderful benefit. I'm going mute now. Thank you.
That is a great question.
Great question, Justin. Thank you.
Just 'cause people don't remember.
Joe Appleton, you're back.
So just again, forecasting other questions that may come up eventually. You know, is there any thought or into expanding this, even if it's at a payable basis, for other family members? So for a child, and is there an opportunity to still have some services that still, you know, Beth, pay your bills and compensate you for the effort, but also end up still being significantly cheaper than bringing them to the pediatrician at $190 for a 10-minute virtual meeting?
Got it. First of all, I can say that most of my clinicians like the 13 and up. We don't do a lot of work with under 13. I mean, we'll see folks under 13, but that would be 0.5% of our clientele in general. And I know that Leanna Percy, who's a PA, I think she's 16 and up. Pediatrics is not her thing. Clinically, pediatrics, I'm not even licensed under age 13. So I don't know the answer to that. It's something we can certainly look at in the future and write down as something that some people would be interested in doing. And how do we suss that out? I'm assuming you have deductible.
Yeah.
Are you
Exactly.
on insurance right now?
Yes.
Yeah. So, maybe there's an opportunity to do something with a combination with your pediatrician, because depending upon the age and everything, there's all kinds of immunizations and various other things that we typically are not connected up with, like a pediatrician. But a young adult, we might, down the road, we might be able to deliver stuff to a young adult.
Or then maybe a spouse or something is something for future discussion too.
Yeah, that's all future discussion. We need to go through the hiccups first, and then we can talk about how that would be dealt with for spouses.
Thank you.
Yep. Anything else from our panel here today? Can you get your hand raised?
Yeah, I know. I'm waving.
Oh, you waved?
Try to pull what they think, Matt.
So what does everybody think? I'll kind of go down the line. Is Joe Prowse, is this something that you're going to consider? You want to unmute yourself and just chime in? That'd be great.
Yeah. I'll definitely like to look into this.
Okay, excellent. What about you, Justin?
Yeah, without question, absolutely, and I'm going to encourage everybody I come across to do it as well.
I like it, Justin. Thank you.
He's our PR guy.
Yeah. Ray Paul, you got anything to add? And what do you think about the program?
Well, I think it's a great program, and I'm very appreciative of ECI for doing this for us. It's amazing, and thank you, Beth, very much.
You're welcome.
Thank you, Ray. Brian Labonte, go ahead. Floor's yours.
Yeah, I just wanted to say thank you to everybody. It's awesome.
Awesome. Joe Appleton,
Everybody should take advantage of it. It's a really good thing. Thank you.
Yeah, thank you, Brian. Joe Appleton, anything to add? Are you interested?
I'm definitely interested, and I'm super appreciative to the opportunity to test the waters with something too. I think it's a great thing, and I think that's what the world needs right now, is breaking the mold and trying to get, be more commune in our working together. So thank you very much. And one question though, not to go back on the positive vibe, but so something might come up. Employees, obviously, most of this is going to be during the day or late afternoons visits. So probably people jumping away from working hours. So I guess internally, these would be non-working times that we would maybe just need to communicate and make sure is unless the intent was to also keep people paid during their visits, which I'm not sure if that came up. I may have missed it. More of an internal policy question, I guess, than anything.
I'm okay. Let me make sure my.
Ken's going to respond here in a second.
Yeah, I'm okay with the company paying for the initial visit for the time the employee spends at the appointment.
So that initial visit,
How's that?
the initial visit to get into the program will be paid by ECI at your wage, but then any future appointments will not be.
Just do it like you normally would.
Yep, just like a DOT physical. Let's see, Kyle Manoski, do you have anything to add, and are you interested in the program?
I'm very interested in the program, thank you. And I'm really appreciative of that because I've been looking for a new primary care. So that's very helpful.
Thank you, Kyle. We appreciate it. And Nate Luigi, thanks for joining us. Do you have anything to add? And are you interested?
Yes, interested. My only question, I have a DOT physical in June, so would it make sense to just loop them together, or is it?
Yeah, we can loop it together. When you call to book it with us, please tell the staff that you're doing both because we're going to want to plan a little extra time.
Okay.
We'll deal with the DOT portion, but then we're going to step back and deal with the more primary care preventative modes of, your medical history, your family history, and all that kind of stuff, and then a blood draw.
Sounds good. Thank you.
That's another good question.
Thank you, Nate. Well, I think that's everybody. Alberta, anything to add? Good. Ken, anything to add on top?
I'm good.
Ben, anything to add?
No, I think we hit most everything.
Okay, with that said, Beth, thank you very much.
You're welcome.
Thank you for everybody. We got this recorded, so we'll put it on our YouTube channel later for the ones that might have missed it. And if you please, try to promote and to talk with your fellow coworkers regarding this program.